Thank you, Mr. Speaker. This issue is a matter of life and death, and the Minister has a very good opportunity to speak to Kenyans about this. Minister, a living patient by the name of Sheila Litunya Omngala from Kakamega, Butere, working in Nairobi. She went to deliver. She had paid for SHA. She's a small mama mboga in this town and what have you. She had done her part. But at the end of the process, she was faced with a bill of 51,000, of which thankfully SHA paid around 400,000. The remaining 200,000, they told her, you must pay. Minister, this is the elephant in the room. When a poor woman like that who had played her role, she had paid. She then has to pay 200,000. Then they can't say SHA is working. Because these are the same women, when she was delivering her first and second child under Linda Mama, she just went, delivered, and went back home. But in your case, she's being challenged, despite being a member, you must pay. I want to thank the Senator of Nairobi, because I had to use his office to get to social workers for me to get that bill to be waived. Not many patients have access to us leaders.
What is your
question,
Minister,
my question?
Senator Boni?
Yeah, I had to pay it because I feel a lot of pain about Litunya.
I share your pain, but
yes.
Go straight to the question, Senator.
So, Minister, the question you must answer for Kenyans, this extra bill, which SHA expect people to pay, why don't you accept that it is a statement of a failed system of funding, and therefore you rework it so that patients, my dear brother, can enjoy in the same manner they were enjoying under Linda Mama. When you convert Linda Mama into Linda Jamii, that is fraud, because in Jamii, people, and Dr. Moth is there, some of the people in the Jamii have got backache, some weird things, but delivery of mothers is a serious emergency which is life-threatening. You've just told us about the 355 women who die out of 100,000 people. That should not happen. Governor Wamatangi has shown you the way in Kiambu. He has sustained 8 months without a single maternal death. It's doable. And because my younger colleague is there.
Senator Beatrice Akinyi.
Thank you, the Honorable Speaker. Welcome, CS Duale, to the Senate. And from the onset, I want to say that Linda Mama was one of the best things that happened in this country. My question is, Honorable Speaker, CS, are there health facilities in this republic holding mothers that have delivered for non-payment of bills? And what is the policy of the ministry? Because the ministry is the custodian of the sector's policy. It is sad that there are children who have to spend their first days in hospital because their mothers or their parents or their guardians cannot pay bills. Thank you.
Senator Nabuire.
Thank you, Mr. Speaker, for the opportunity to contribute towards supplementary questions to the CS. One, I would like to ask the CS that anti-D for ESA's negative was a part of the Linda Mama package, but it was scrapped off. So currently, most mothers with this condition are not getting it because of the cost. Secondly, I would like to informed that sometimes patients are not.
Senator Nabwire, you are entitled to just one supplementary question, which you've already asked. Kindly take your seat. Senator Hamida.
Thank you, Mr. Speaker. Bwana Waziri, looking at Linda Mama, unfortunately, you know, free things also at times, you know, they come with a price. We have going to, when we inspect hospitals, we have found shortages of staff, high workload, inadequate equipment, inadequate beds, delivery theaters are not there. And seriously, it's such a pain to see that, imagine, you know, you have a maternity without theaters. So I'm just wondering, is there any awareness? And also looking at awareness on women, especially the young mothers, that at times the marginalized groups need to know about the right of the Linda Mama and what's covered and how and the access to Linda Mama. One last thing is that the tracking and accountability, Bwana Waziri, how do you monitor for empowerment working? How do we link that monitoring of these programs to outcomes, you know, looking at maternal mortality? Bwana Waziri, I had a motion here in Parliament on postpartum depression, mothers on mental health. And I think my motion went through, and so I think the hospitals need to have a wing for postpartum depression, Bwana Waziri. What we found it very fun is that we've gone to many hospitals, found mothers who have given birth, and they're...
Senator Hamida.
Yes.
You have asked...
Many
questions. Kindly yield. Senator Chirange.
Thank you, Mr. Speaker. Mine is Waziri Duale. Welcome and thank you. You are doing a good job. My question will be very simple, Waziri. This transition from Linda Mama to Linda Jamii, did we at any point lose the package of Linda Mama as you transit to Linda Jamii? Can you give us the package so that you debunk the street political fraud by Senator Kalwale, so that Kenyans, this is the only forum. We don't want Senator Kalwale to go to Malinya and mislead people that shifting from Linda Mama to Linda Jamii is a fraud. You have the opportunity to shine, Waziri. I yield.
Senator Meth.
Thank you very much, Mr. Speaker. Sir. Mine is actually related to what Senator Akinyi asked, and I saw the maternal deaths report, and Nyandarua had the least maternal deaths report in the entire republic. But my question was, Waziri, since most of these facilities that we have are run by county governments, my question is, in terms of detaining mothers and their newborns, is there a policy in the ministry as to how long a mother can be detained in a hospital because they're not able to meet their bill?
Senator Mungatana.
Mr. Speaker, thank you, and thank you, Waziri, for the good job you're doing at the ministry. Mr. Speaker, we pay 2.75% of gross with a minimum of 300 shillings, or means testing is done, and we pay 2.75%. Now, this is what Kenyans are paying. The question I wanted to ask you, Mr. Speaker, through the minister, through Mr. Speaker, is that in this country, we have many other African nationalities who are living here. And maybe part of that report of deaths includes the nationalities who are living in this country from other African nations. I represent this Senate in the Pan-African Parliament. And the question is, are people covered, those who are not paying, like those who are not paying SHA now, are they covered in this Linda Jamii? What do we do with them? How do you take care of the Congolese, the Zambians, the Ethiopians, and everyone who is living here? Your system of registration says *.147 hash. And if you go down, the next is your ID number. These people don't have ID numbers. What do we do with them? They are with us here. They are still going to give you those maternal deaths. What do we do with them? What is the stand of the Kenya government on this matter? Thank you, Mr. Speaker.
Senator Newton.
Thank you, Mr. Speaker, for the opportunity. And allow me to just remind Waziri that the duties under the ministry that he has are very massive, Mr. Speaker, because you can live without an education. You can actually live, you can actually borrow some food from a neighbor, but you can never borrow health from a neighbor. You cannot live without good health. Mr. Speaker, I'm just trying to tell the CS that he would do better to work more than he does politics. That having been said and done, Mr. Speaker, I want to ask the CS, he has in his response about Linda Mama, he has said that they transited from Linda Mama to Linda Jamii. And one of the benefits that according to the response by the CS, one of the benefits then becomes, Honorable Minister, what is the ministry doing to see to it that there is prevention of teenage pregnancies in order for us to do prevention, because we have always been told that it is better than cure? That's my question, Mr. Speaker. Thank you.
Senator Gataya, more fire.
Thank you, Honorable Speaker. My question is very simple. What is the fate of thousands of Kenyans who cannot afford to pay SHA for themselves?
Honorable CS, you may now proceed to respond.
Thank you, Mr. Speaker and members. Let me start with the question by Honorable Senator for Uasin and the chair of the Health Committee. Yes, the matter was very unique to MTRH. That issue we have resolved. Those mothers who had, mainly they had no IDs, and but we made our own internal contingency, and SHA has paid, and we have told the CEO and the current leadership at MTRH that that should not happen again. The question to my former colleague and senior Senator Boni Khalwale, and Senator Boni Khalwale, I will not take the advice of the Senator for Nandi, because I'm here to answer questions from senators in either form. Senator Boni Khalwale is also a medical doctor. I think the case you have mentioned first must be a very complicated case of delivery for it to reach that level of 600,000. So that was a very complicated case. And SHA covered 60% of the bill. And this must be very clear. Even during the NHIF, there was no full coverage for NHIF. So SHA will cover the bit that is required by law for SHA to pay. There's nowhere where you have to pay 100%. I mean, even myself talking, I have patients. And if the bill is $1 million, SHA pays 700, then the other 300 is an obligation on the part of the family members and relatives of that patient. So, and I think we did our bit. If I go to Linda Mama, first there's no Linda Mama that exists. A transition was done, a more comprehensive, better Linda Mama is now anchored in SHA. And Honorable Speaker, I said it when I was answering the question. And in the answers that I have given to the honorable senators, if you look at it, there's a table. And I'll give you an example. Linda Mama, for level 2 and 3, were paying 2,500. For level 4 and 5 and 6, it was paying 5,000. And in fact, there was no equity. They were paying more for faith-based and private, and less for public. The highest they have paid for cesarean was 17,000. Today, under SHA, It's more expanded, more comprehensive. Any delivery that takes place in our country, if you are registered under SHIF, SHA will pay 10,000 from the 2,500 of Linda Mama. So Linda Jamii is paying 10,000. For cesarean, we have moved from 17,000 to 30,000. That is progressive. And it covers comprehensively. For Linda Mama, it was only, Honorable Senators, through the Speaker, it was only for delivery. But for Linda Jamii, it is everything surgical, anything that that mother and her child will require, even the treatment of post-delivery. Under Linda Jamii is very comprehensive. I have given the data, and you can look at it. 2, it was budgeted, so the budget was not predictive. We inherited 4.2 billion shillings debt of Linda Mama. Today we will not inherit anything. Today we have no bill. Every mother in our country, and about 1.2 million mothers deliver in our country annually. We can give you those who go through SHA. Since SHA inception in October last year, are close to about 690,000. There are many who are delivering maybe at home. There are many who are delivering in private hospitals and paying for themselves. So my senior Honorable Khalwale, this mother could have had a bill of 500K paid, and I'm sure the balance the family will. But I think those are rare cases, are very complicated cases. No more delivery, no more cesarean. You are a doctor. You can do better. Again, with Honorable Mandago, let me just read the package, the SHA package, benefit package, that covers normal delivery at 10,000, and this package includes all that you require: medicine, drugs, procedures. This was not found in Linda Mama. It can only be found in Linda Jamii. So Linda Mama has transited to a more comprehensive healthcare delivery system for our mothers. If a mother exceeds 3 days, as he said, the SHA package reverts to a duly bed rebate, which is found in the law that you have passed. So if a mother stays over 3 days, the hospital is to notify through our system, the SHA leadership and officers, and they will do it. Honorable Senate Minority Leader, I agree with you. We have a serious problem in the implementation of the primary health care. Fund. Our level 4 sub-counties, Kenya outpatient, Kenyans, all they need to do is to register as SHA members. They don't need to pay, because it is paid by the exchequer. It's paid by money appropriated by Parliament. But we have incidents in few counties, and you have heard many times the President talking about it, where county ruto. It has never happened. And this is and I think this is where Senate will help me, because the Senate oversights counties. Senate oversight counties. The Senate Health Committee should go and do a report and identify. And we are ready to give you There are 2-3 counties we have found out, and we have told them, and what they're doing is criminal. It's criminal, it's against the law that you have passed. 200 Bokalwale, I don't know whether it was you. The maternal mortality figures you are giving for Kiambu County is not correct. Yes, it's wrong, and I think it's good you withdraw it. And I am ready to provide. There are many mothers who died, particularly when doctors were on strike. I have the names of the patients, of the mothers, and I have the names of the newborns. I think for record purpose, before the strike, they were doing well. I agree with you. Kiambu was doing well. But as the Minister for Health, I want to confirm to the nation that I agree with the union, with the doctors, that a number of maternal deaths occurred. And I'm ready to provide that evidence. So please, I don't want Governor Wamatangi to hear that and then says I heard it from the Senate. That information is not factual. Senator Nambwere, I think for the first time the anti-D is an injection. I think the doctors like Dr. Khalwale can explain. Is now for the first time is covered under SHA. This is one that helps in the spilling of blood. So this is a more comprehensive now which is found in the Linda Jamii than the Linda Mama, and the reimbursement for that injection alone by SHA is 6,000. The Senator for Nyandarua, Your Excellency, I think he has left. And it's not good, Your Speaker, that you ask a question and then you are not around. When I was there, it's not, because you know what was the purpose of asking. But because I'm going on record and the senators are listening to me and the Speaker, let me answer. I think it's good to listen. Anyway, I've done it. It's okay. That his question was policy, and I want to tell him that policy does not allow definition of any patients, including mothers and newborns, in all our health facilities. And we really want him to report to us any such facilities for appropriate. We want the leaders to report. To us, and we have a package. Tariffs are better by 3 times the tariffs provided and benefit provided by President Ruto's government. Is far much better than the one of the old government. And why do I say so? I mean, from 2,500 to 10,000 for normal delivery. 17,000 to 30,000 for cesarean section. That alone tells mothers in our country are fully covered. They just need to walk to any health center with their birth certificate or with their parents' ID, special ID, a temporary ID for all our teenage mothers. We don't want to encourage that. The Linda Jamii covers the whole family. It doesn't cover only the mother. Linda Mama was covering only the mother. This one is covering the child, even after they leave, so this is a more comprehensive. Linda Jamii now covers, Linda Jamii, Mr. Speaker, covers 28,000 per day. This was not present under Linda Mama. And I really want members to get to the package. Linda Jamii now covers anti-D, as the Honorable Senator Nambwere have asked. Linda Mama never used to cover that. I can talk the whole day if you ask me to compare Linda Mama and Linda Jamii. It's world apart. It's like first world, third world, and first world. So I think we must thank. Prevention of teenage mothers, advocacy, we must do a lot of advocacy. A lot of advocacy with our community leaders, with our church leaders. I think it's a responsibility for all of us. We should not promote it, but we have no choice. They are our children, but we must see how we can reduce it. We must ensure our girls enroll in schools and they stay in schools. That is one way we can. We must make sure that school health programs to teach girls and boys about changes of their parental, premarital sex is part of our curriculum. We must have peer-to-peer support for all adolescents. Honorable Speaker, I don't know whether I have left. There was a question by the senator for Muranga, and Mr. Speaker, I have read the law. I'm coming to the honorable senator for Tharaka. Cabinet secretaries by law, we are politicians and we will politic. And I want him to read the Conflict of Interest. I want him to read the Conflict of Interest Act, which was passed, which amended the Leadership Act. Anybody else in the public service cannot do politics. But CSS, the law allows me, and I've tweeted it, and Honorable for Muranga, you have to live with me. I serve a political government, and the law allows me. If you change the law and says ministers should not politic, I will not politic. But for today and going forward, I abide by the law. I'm going to do politics. You know, I agree. He says
order, honorable senators. You've already responded to that,
yes.
honorable.
The last one is on the senator for Tharaka Nithi, the great county where our very able and intelligent deputy president comparison. I have a lot of respect for the former deputy president, but I'm just talking about the current deputy president senator. Those Kenyans who cannot pay is a very good question. Before NHIF was a club, the former NHIF, only 1.8 Kenyans in the informal sector have registered. Today I want to report in barely 1 year, because we are about to celebrate 1 year of SHA, over close to 1 million Kenyans in the informal sector have registered SHA. How do they do? There are those who can, they go through the mean testing and they get the amount and they pay. And there are those who can pay. That's why we introduced SHA Lipa Pole Pole. And I want to tell the House, since we introduced SHA Lipa Pole Pole, we have collected over 650 million shillings, where Kenyans go through that, they pay 4 months, the other 8 months, they pay through SHA Lipa Pole Pole, either daily, weekly, monthly. And Kenyans have embraced. As of last night, the figures we got, over 2,000 Kenyans went through the mean testing and paid and through the SHA Lipa Pole Pole. So it's growing. The budget itself and the senators and the speaker are paying more so that the lady in the market, the boda, the people at the lower level of the society can pay less. They can pay 500, they can pay 600 per month, totaling about. There are even those who pay up to 3,600 annually. So, Mr. Speaker, I think I have answered all the questions. Yeah, foreigners, I agree with you. Number one, foreigners have alien cards. foreigners have different immigration documents. They can use those documents to pay for SHA. The United Nations High Commission for Refugees have signed an MOU with the SHA, and they have brought their people on board, all the refugees, to join SHA. So alien cards are allowed. They can go walk in and pay cash. They don't need to go through the system. And they can use any of the documents, because they must be using a document to stay in our country. They cannot just be in our country without a document. So the document that they will use can be valid for SHA registration. But the one you have seen, Honorable, my neighbor, Senator of Tana River, is the one that is only meant for the people of Kenya.
Honorable Senators, we shall now move to question number 117 by the Senator for Kisumu County, Senator Professor Tom Ojenda. And Senator Beatrice Akinyi is going to ask that question on behalf of Senator Ojenda. You may proceed, Honorable Senator.
Thank you, Honorable Speaker, once more for granting me the opportunity to ask on behalf of Senator Ojenda. The Senator for Kisumu County